All right, looking at hip lateral rotation or external rotation, remember that we're looking at the transverse or horizontal plane. So that's as if you're looking down and you're going to have a rotation posterior or a rotation anterior. So towards the midline or away from the midline. So medial rotation, lateral rotation, internal rotation, or external rotation. And let's start this. So you can see your toes start to move out. Your biggest lateral rotator is the gluteus maximus, and the details of the gluteus maximus have been discussed in different videos, but just as a reminder, it's also a major hip extensor muscle because it's posterior, but the line of pull for lateral rotation, it's pulling this way. So that will pull it into external or lateral rotation. Inferior gluteal nerve is its innervation, and it's coming off the iliac crest, sacrum, and the coccyx to the gluteal tuberosity and the IT band. Then underneath that big muscle, we have 6 external rotators. And you can see here 1, 2, 3, 4, 5, but there's one on the anterior side. So there's 6. The easiest way to group them is that they're coming off somewhere near the greater trochanter, and then they're coming either down the ischium. So let's look at these muscles. From superior to inferior, we have first the piriformis, which some people mistake as the gluteus minimus. So remember this on practical exams that the piriformis can sometimes look like the gluteus minimus. And so it's posterior, and its line of pull is pulling you into external rotation. And then we have the superior gemellus muscle, again, the line of pull, it's pulling into lateral rotation, coming off the greater trochanter. And if we have the superior gemellus, you're going to see in a few minutes we have the inferior gemellus muscle. Here's the inferior gemellus, and we have a muscle in between, which we'll talk about in a minute. So superior and inferior gemellus muscle, and the last bottom one is the quadratus femoris. And so it is, looks like a rectangle, quadratus femoris. Again, lateral rotator. Then we have the obturator internus, and this gets a little bit confusing. The obturator internus is internal because it's coming off the obturator foramen on the inside of the pelvis. So definitely look at this when you have a pelvis to look at, and its line of pull is pulling into lateral rotation. If you have an internus, you're going to have an externus, which you can see from the anterior side. Oops, let me get back to that. And sorry about that. So this is, we'll get this, pause it. All right. So the obturator externus is you're looking anterior on the outside of the pelvis. So it's on the external side or the outer side of the obturator foramen, and that's called the obturator externus. Some more details on the lateral rotators of the hip joint. Again, there's 6 muscles, and they attach on the ischium, obturator foramen, and the sacrum. Their common function is lateral rotation of the hip joint. And just to note, the piriformis is also abduction because it's more on the lateral side. Here's kind of a schematic of them from superior to inferior: piriformis, superior gemellus muscle, obturator internus, inferior gemellus, and the quadratus femoris. This is what you see from the posterior view. On the anterior view is where you would see the obturator internus, or I'm sorry, obturator externus. So obturator internus is on the posterior view. If you're on the anterior view of the pelvis, you'll see the obturator externus. And just some study questions if you want to quiz yourself. So identify 7 lateral rotators of the hip joint. We talked about 6, and then there's another big one. The 6 small lateral rotators basically share which bony attachment point, and when can you see the internus, or why can you see the internus from a posterior view and not the externus? And again, that's thinking of the pelvis as a 3D structure, which it is, and where you're looking at obturator foramen. A few more details about these deep external rotators, and they're deep to the gluteus maximus, which is also an external or lateral rotator. Again, learning muscle groups with function that they share is appropriate for anybody going into any of the rehab professions. So the 6 lateral rotators, that's why we're learning them together. Their neural innervation is pretty easy because it's just the nerve to the gemellus superior, nerve to the gemellus inferior, nerve to the obturator externus, nerve to the obturator internus. So it's a little straightforward in that regard. They share the greater trochanter as an attachment point, and then they just come off either the obturator foramen, which it's in the name of those 2 muscles, or they come off the ischium as well. So just kind of think about where they go. It seems overwhelming that there's 6 of them, but when you kind of put features together, it becomes much, much easier.